So I practice integrative medicine. So I am in traditional allopathic medicine, where we prescribe medicines or do surgery for the physical body of the patient. But today's world, that's not enough. So I integrate that with energy medicine, meaning we have an energy body that also interpenetrates the physical body. So I treat both the physical body as well as the energy body.
So my next question is, what is changing in the medical world with regards to treating patients?
So we find that more and more of my colleagues are starting to look at mind, body, and spirit. So just treating the body alone for the last 150 or a few hundred years is insufficient, because we're starting to realize that the problem, the origin of a lot of these illnesses and diseases actually start in the mind. For example, a heart attack. We know medically, we say, well, they led a very stressful life. So stress is an energy. So we are starting to expand more into wellness, mindfulness, meditations, and one of the latest technology is energy medicine.
Well, I think that's great that a doctor prescribes you, you should meditate.
That's fantastic. And that's the way forward. Yeah.
And my next question, why is it important to treat the energy body and the physical body?
So everything starts in the subtler. So we have an energy silhouette, and the energy body interpenetrates the physical body. The energy body is both inside and outside the physical body. So for example, if we want to have a cup of coffee, we first think, oh, I'd like a cup of coffee. Then we actually get up, which is moving the physical body, and boil the kettle and make a cup of coffee. So simultaneous disease also starts in the subtler or the energy world first. So everyone has probably had a cough or a cold before. You almost always know 2 days before that the cough is about to start. And why is that? Because it's starting in the energy throat, or we say the throat chakra. So it's important to get to the root of the problem. And if we actually tackle it in the energy or the subtler state, then there is no chance for it to even physicalize. Or if we catch it later, the symptoms are milder and the recovery tends to be a lot faster.
Yeah, that's great. I love it. Can you tell me what are the results in your patients? What are your patients' feedback?
So it's been miraculous, because we don't just tackle the physical body, we also tackle the energy body simultaneously. There is the law of self-recovery, which we teach in Pranic Healing, meaning the body has its own innate ability to recover. It's a little bit like putting plaster of Paris on when there's a fracture. Now, the plaster isn't actually doing the healing. It's there to immobilize the body so that the body can do its own healing. So simultaneously, when we actually treat the energy body or the mold, the body can recover a whole lot faster. So I find that patients can return to work quicker, have shorter hospital stays, and some are also coming down in their dose of their medication or weaning it off altogether. So there's a massive improvement, exponential improvement, both for the individuals, the family, and also the economy of the country.
Can you tell me if there are any side effects to the treatment?
So as far as I've experienced, there's no side effects as long as the protocols are followed correctly. So Master Chow Sui, the founder of Pranic Healing, has gone through the painstaking process of putting everything in a stepwise process. And that's one of the reasons why it resonates with doctors like myself. We're very scientific, it has to be methodical, and then there needs to be validation and proof, which we then get back in our ECGs, blood tests, and x-rays to see that there is a correlation and the results are following really quickly as well.
So as far as I know, patients usually want something that works. So how do you deal with it?
Well, of course, everybody wants something that works, isn't it? Yeah. But I take the same principle that we have in the medical world. When we graduated, we take an oath of beneficence and non-maleficence, meaning you do good, but don't do any harm. And ultimately, there are multiple factors that governs how quickly a patient gets well or whether they get well at all. So in the medical world, I cannot also guarantee that a particular pill or an injection that I give you will always result in the correct optimum outcome. So sometimes we have to change the dose, we have to recalibrate based on the blood results, or change the antibiotic altogether. Sometimes it's a trial and error. So there's no such thing as a 100% guarantee. Even in the medical field, that's traditional allopathic medicine, I can never give a 100% guarantee. So pranic healing is no different to that, or any other modality for that matter.
Yeah, you can actually have no guarantee at all, right? Because that's life.
You can walk out of the door and there's no guarantee you'll be hit.
Exactly. So, is this the first time that doctors are collaborating with some sort of other modality?
So doctors have worked with many different modalities. So there is biohacking, bioenergetic fields out there, and pranic healing as well. That's been used in mainstream hospitals in America, South America, North America, India, Philippines. So it's nice that the UK is finally coming on board as well.